Hello, everybody. We're so happy to have you back. I'm Rachel. I'm the co-founder and chair of the Long COVID Collective, and we are back again today with another episode of The After. And we're going to be joined by Dr. Arlyn Thobaben, who is a doctor of physical therapy, an educator, and an advocate for more compassionate approaches to rehabilitation and PT. With over a decade of experience, Arlene specializes in helping people living with chronic illness, including long COVID, chronic pain, and fatigue, reconnect with movement in ways that are sustainable and supportive. Through her work with ReStory Physical Therapy, she champions trauma-informed, weight-inclusive care and is helping both patients and providers rethink what healing and recovery can look like for the chronic illness community. So, Arlene, we're so happy to have you here today. Thank you so much.
Yes, thank you so much for having me.
Of course. So let's start with tell us a little bit about your background, your experiences, what led you into not only physical therapy, but eventually towards working specifically with people with chronic illness.
Yes, so actually, I don't know if a lot of people know this, but physical therapy is actually my second career. I was first a professional musician and a music educator, and I play the violin and viola. So I was in my first year as a musician in my career, just fresh out of grad school, and I woke up one morning and I was in a lot of pain. And I had never heard of physical therapy before, but someone just said, hey, one of my colleagues said, have you ever heard of physical therapy? Maybe they could help you. And, because I couldn't move very well, I couldn't turn my neck. I had a bunch of students to teach that day. I just didn't know what I was going to do. And physical therapy actually really helped me so much. And I spent a lot of time in physical therapy in an outpatient clinic and was just really inspired by what I saw. People, starting off just fresh from surgery or having a lot of pain or injury, and, following these people working alongside me, we all worked really hard and got better. And so I was inspired to pursue an alternative career path. I still love to play music. I play a lot of music with my family, but now physical therapy is my career. And I started off in outpatient orthopedics. So I did a residency and have a specialization in orthopedics. And did a lot of work in brick and mortar clinics for many, many years. I was a clinic director. And when the pandemic came, something interesting happened, which was we still needed to take care of patients, but they couldn't come in. And so, telehealth physical therapy has been around for a really long time, but I hadn't been exposed to it. And I was given the opportunity to build the telehealth program where I was working currently. And what I realized was that there was actually a lot of people who really benefited from telehealth, um, even after people started coming back into the office. And that really sparked my interest in, hey, like creating improved access for people who can't necessarily get to a clinic easily. And that's where I began working really extensively with the chronic illness population. And with the UT Health Clinic, the long COVID program, they were looking for someone to help come up with a program that would be beneficial for people going through long COVID, which was so new to all of us at the time. And so that became something that it fell into my lap, and I've been so like grateful for that, because now this is what I do.
Wow, that's so interesting because I mean, like what you're saying, it's so important and it opens up like such a expansive, community of people, like you said, that cannot come in to the office or to get that kind of PT treatment. And obviously opening up to this entire, chronic illness, long COVID community. And I love that. Well, I don't love it. It's sad, but I'm happy to hear, of your experience because it's very relatable, obviously, to us and everyone in this community to make, you woke up one day with, something different in your body, something that was suddenly hurting, kind of forcing you to, abandon your former career and then pursue something else, which is something that I think all of us can relate to. I know I definitely can. I wouldn't be here if I hadn't been sick. So I think that's really unique, kind of cool opportunity, for you and for the rest of the community. So for any listeners who might be unfamiliar with kind of what this more accessible form of physical therapy looks like, how do you define chronic illness friendly physical therapy, or what are some of the approaches that you use aside from the virtual aspect?
Yeah. So, with chronic, when I think about chronic illness friendly PT, I think of, actually taking the time to listen and to really make sure that I've taken the time and that the patient has had, multiple opportunities to share all of their concerns and everything around it. It's not just about their symptoms or concerns, but it's also context, right? Things that have happened to them. I think it's also really important to acknowledge, medical trauma that um, people have gone through, because that makes a big difference in how they show up and how they approach care. I think a lot of people are really hesitant to even start something like physical therapy with a chronic illness, because they've been in situations before where they haven't been believed, or they've been asked to push through symptoms that they knew at the time were not good, but didn't feel comfortable speaking up, or putting a stop, exercising their autonomy in that situation where they've ended up pushing through. And so I think chronic illness friendly PT like knows all of that ahead of time, and takes the time and make sure that the patient feels like they have a sense of control in their plan of care.
Yeah, absolutely. I think that's, obviously so relatable, not only in physical therapy, but obviously in the medical offices and everywhere. The top complaint is always that I'm not being believed, I'm not being listened to, my experiences, symptoms, etc., aren't being validated. And yeah, and I think that's especially interesting because especially for like a PT or kind of, body-based movement stuff, a lot of the times chronic illness patients are told to, push through the fatigue, push through the pain, everything, and to see kind of, the negative impacts then that can have. I know that most of the time leads to worse symptoms, more fatigue, more pain. So I think hearing that is probably validating for a lot of people in the community. So I know that you kind of mentioned this and we're leading into it now, but what are some of the ways, or what are some of the things that you've seen or heard from patients are ways that standard kind of PT practices or medical practices in general for people with conditions like long COVID, ME/CPS, dysautonomia can kind of fall short in their treatments.
Yeah, so I think there's definitely we need to be better at everybody learning how to screen for post-exertional malaise, or PEM. Some people call it post-exertional symptom exacerbation. I don't know that everybody understands how to screen for that. And a lot of that is actually what I've already talked about before, which is listening to all the concerns. You can kind of hear, oh, well, I crash hard and I have to be in bed for 2 days after I did something, and it didn't seem like a lot, right? That would be like a ding ding. Definitely that's, a sign of PEM, but not everybody knows to screen for that. And if that is present, and even if you're just suspecting that it's present, it really changes the focus, and we really need to be very intentional about how we dose movement. And a lot of this, honestly, like I've made mistakes, right? You already heard that I started this program without really even knowing anything to begin with. And we learned really early on that even the very basic things, it could even be in the very beginning of the appointment where you're asking your usual questions and then starting a very, standardized basic assessment, but even those things can trigger PEM. So we learned that the hard way early on, and I really wanted to make sure that, we're not over testing. We're not expecting too much of patients, especially on the first visit. Um, you have to consider just how much energy the person has spent already getting out of their house, walking into your clinic, waiting in your clinic, and then having the load of meeting a new provider where you're not sure if they're going to take care of you or not. That is a lot to handle. And then you're asking them to do this physical test and answer all of these questions. So I think we need to really be mindful of that, how much we test and how much we ask. And the other thing comes naturally after that is how much we do in intervention or treatment, right? And so the consensus amongst like most people that I've talked to who have had poor experiences in PT in the past is that they just overdosed on exercise, on movement. They did a little too much. And it's really hard for the therapists who don't really know about it yet because the thing, even if we're watching the patient for an adverse response, we are not always going to see that in the clinic, right? Like a lot of people know that those symptoms and those crashes will often happen after you've left the clinic. And so at that point, it's too late. And so, yeah, I think we over ask, we over test, and we overdose.
Definitely. Yeah, and that's great because like you said, a lot of the times, even just getting to the appointment, the waiting, the emotional fatigue that comes with that for someone with a chronic illness is just as much, just as impactful, sometimes more than like the physical actual exercises. So it sounds like what you're saying is a lot of that has been kind of just, learned and adapted through your experience, through talking to these patients, through being hyper aware of kind of the feedback that they give you, and then you kind of adjust as needed, I guess, per patient.
Hmm.
So tell us a little bit, what with the rise of, long COVID, obviously there have been chronic illnesses for the history of time, but with more, recently onset long COVID, other kind of chronic illness, virus related illnesses, how has the demand for your kind of patient per patient, focused work approach changed? And what are you seeing? That clinicians, maybe standard clinicians, still might not understand that's important for them to know.
Yeah, so now that we've had, more people having long COVID, and I think, yeah, the people with living with chronic illnesses have been here, right? But now we know that there has to be an approach that like respects your energy limits, right? And that kind of care is just not really typical, especially in that outpatient setting, because you think about physical therapy and you think, okay, I need to rehabilitate and I need to get stronger and I need to improve my aerobic capacity and I need to make my joints more bulletproof so I have less pain. Um, that's all true in the case of chronic illness and long COVID, but we just have to be very mindful and again, very intentional about how to do it. Because if we start triggering post-exertional malaise through our interventions, then, we're going to set the patient back, and there can actually be a harmful result to that. So I think a lot of people are seeking out therapy that actually protects against those energy crashes, and that are more aware of how to take care of the system itself, right? All the things that you're carrying while doing rehab. So it's not just the rehab, it's all the other things that are happening at the same time. And I think that, movement, exercise, it's obviously part of the picture. That's like our bread and butter, what we do as physical therapists. But like the symptom guided approach is what people need, right? And we really need to be aware of that delay of onset of symptoms and knowing that ahead of time. And the way that that changes things, right, is that actually if you look at what I do in my sessions, a lot of people go, well, that's it, right? You're not going to ask me to do more. Shouldn't I be doing more? And and the answer is not yet, right? We need to know what your response is going to be to this very little bit. We need to gather some data. And so we do use a lot of data from like getting your heart rate and your HRV numbers to understand if we're dosing properly. And then, of course, looking at what your response is in the days after you're seen. Um, and and so that kind of brings me to the point of, I think a lot of clinicians, especially like in the outpatient orthopedic world, will attribute symptoms to deconditioning, right? So of course you're not getting out of bed very much, or you're limited to moving around your house. You're not getting out of the house very much. You're not standing up very much. You're getting deconditioned, and therefore we need to recondition you. And that's not the main point, right? So there's actually an issue with energy metabolism, energy that's not there to begin with. And so you can't recondition a system, muscles. You can't do that if the energy system isn't working and if you're crashing all the time.
Wow. Yeah, I love the way that you described, that the whole system thing, because it really is a holistic approach, everything that you're doing. And that's something that, the general population could probably benefit from, but especially obviously chronic illness patients, people that are so have to be hyper aware of their body, their symptoms, how things are reacting. So it sounds like you take a very slow, patient-based approach, incorporating how they react like over time instead of just forcing them into something that they then have to recover from, which sounds like a very, respectful. I wish I had I wish I had this experience when I was going through my worst of my issues. Definitely sounds like a very kind of accepting, slow-paced, patient-led process, which is great.
Yeah, and it's not just the therapist that has to adopt this new way of thinking and relearn how to do rehab, right? It's also the patient side of it too, because you all have expectations of what rehab should look like. I should be gradually increasing my intensity, my duration. I should be pushing myself so that I can do more tomorrow than I can do today. All of that is like so deeply ingrained in how we do
True.
things, how we think. And so honestly, a lot of patients start with me and feel very frustrated initially, even with my approach, because it doesn't feel like it's doing anything, and it doesn't feel like it's productive. And so there's a little discomfort sitting with that and trusting the process.
Definitely. It's so interesting because I can see how that would be the case for sure. But, I guess it's the long-term benefit versus the short-term, gains in the moment, maybe. Um, so on that topic, you are part of the Long COVID Collective's new video series about this, which will be hopefully coming out to you guys in the fall. So can you tell us a little bit of background about this project that we've collaborated with you on and, what you are contributing and also what you want patients who may be, watching that series or clinician to take away from those videos in that project?
Yes. So I'm so excited. I've never been excited about a professional collaboration before with y'all, with the Long COVID Collective. Our video series is called Moving with Energy Limiting Conditions. And so what we're trying to provide is like a low accessible entry point to intentional movement that feels really good in your body, and that can be practiced on your own in the comfort of your home. And to have those videos accessible for free. We understand that not everybody has access to physical therapy. Not everyone can get to an office. Definitely, there are not enough rehab therapists out there who can support energy limiting conditions, especially if you're, in bed a lot or you have a really hard time getting to the clinic. And so we've created 6 videos so far, hopefully more. And so we're just trying to share some skills, right? Ways to move that are not draining, that are maybe even accessible on a lower energy day. And so we have Long COVID Collective members actually demonstrating the movements. This process was amazing because we were able to meet with members of the collective, test out the movements, get feedback on them, make sure that they feel appropriate, they feel approachable. And, it includes a lot of expertise from members of the collective as well. So that's one of the major teaching points. I teach a continuing ed course for PTs about energy limiting conditions. And my number one slide is that the patient is the expert, right? You're the expert in your body, you're the expert in your condition, living with your condition, and you have so much knowledge. And so we pooled some of that knowledge in like a crash and flare management video, which we're excited to share. And then we also pulled together some resources for self-advocacy. So even down to like some scripts that you can use when you're talking to a rehab clinic, kind of testing out to see whether or not it would be a good fit. And we're also preparing a letter that you can give to a rehab therapist that very clearly explains that you have an energy limiting condition, and these are the types of accommodations that I need. So yeah, we're super excited to get that out there, and I know a lot of people have worked hard to make it happen.
Yes, we are so excited that you were willing to collaborate on it. I know it's something, we've been talking about ways that we can give kind of a lot of resources to our community. And this is obviously an area we haven't really dove into yet, but we're so excited to be able to share these videos. And I think that they'll be very interesting. And like you said, hopefully just a beginning point for someone that maybe hasn't been exposed to this kind of practice before to kind of get into it and then be more informed if they do ever need to go into that office or have another provider, or if they need, a provider in general to know that this exists and to know that there are these other methods out there. So we're so excited, and I can't wait to see the videos. Um, so let's see. So just a couple more, questions here, but what do you believe are some of the things that still need to change in the broader medical system to better support people living with chronic illness and everything that comes with that?
Yeah, so for the broader medical system, I think that number one is like a culture of believing the patient and listening, even without like test results and biomarkers. I know you all know this because you've lived it, that it's very frustrating to live with these chronic illnesses that oftentimes lack a biomarker or something that like proves from via a lab that I have this condition. And we spend so much energy in the medical system trying to get to that diagnosis, and that doesn't always take into account the amount of effort and the amount of self-advocacy that you all have to put in. And so just starting with that culture of believing and listening, I think would make such a huge impact in people's experiences. Um, I also think that every clinic should be equipped to shift appointments to telehealth whenever needed. So there's just, again, so much time and energy that goes into getting yourself to an appointment There are some mornings where you wake up and you just know that it's going to either take everything that you have and probably even everything you have tomorrow to get yourself to this appointment that you need to get to. But if there was a way to toggle switch like to telehealth on that day, and every doctor and every clinician was ready and willing to have that encounter via telehealth, I also think that would be really beneficial, and cause a lot less stress on the medical system, right? Because when we miss appointments, it affects the patient, it affects the system. So I think we need to do that for sure. Um, I also think that providers in general need more time resources with patients. It's not something that I feel like, any one single person can change, um, but in our healthcare system, we are under pressure, right? A lot of time pressure, and it doesn't feel like you have that time to really feel like you've gotten what you needed out of that visit on both ends, right? For the patient to feel listened to have had all of their concerns heard, and for the provider to have enough bandwidth and energy to truly address the patient in that amount of time.
Definitely. I love these suggestions, and it sounds like overall it's a more like it's a slower paced, more intentional and flexible system overall. Which I hope is something that, we can kind of expand, like you said, to all different types of providers, especially given the situations and the people that need that in the world today. So yeah, final question, and then you can add anything that you want to, but what would you say, given your experience and your expertise, to someone navigating long COVID or another chronic condition that feels very, discouraged or stuck in their position and hasn't heard about the kind of, resources that you and others offer?
Yes, so I think the first thing that I would say to you would be pause and like give yourself credit for all of the work that you've done to get to this point, even if you're struggling, right? Even if you feel like your baseline is slipping away, or things are really hard, like you have put in so much effort, time, brain energy. You've gathered your resources. So many people don't acknowledge that because you're caught up in the whirlwind of feeling unwell, right? And so, even in those moments when you're feeling very unwell, to pause and give yourself credit for where you are today. And that's number one, because you have strengths, right? You have resources, even though they might not be, energy resources, but those strengths will serve you. And to know that there are people out there who care. There are providers out there who seek to really improve the experience for people living with chronic illnesses. We are out there. I know there can be more. I'm spending some of my energy making sure that there are more, right? That more physical therapists are becoming aware of how to manage people living with energy limiting conditions and chronic illness. So, and then to give yourself permission to start smaller, a lot smaller than you think you need to. Um, because again, if you're feeling very unwell, it might make sense that you're thinking, well, I have to do all of this stuff to even get back to feeling somewhat normal. There's all this work ahead of me. But the very first step, it needs to be small. It needs to be kind to your nervous system, because your nervous system is already overwhelmed. You can't expect to, pour additional load on top of that. We need to start with these little bite-sized amounts that may even look and feel very insignificant. I promise that they're significant, and that, if you give yourself enough time to spend the time on these small things, your body will begin to accept the movement, to learn that it can be safe again. And that's when you start to see the benefit.
Definitely. And I imagine that that's kind of part of also, like you said, retraining the patient to kind of what defines success, or, what am I really getting out of this? I imagine is what kind of you're describing, is like taking at a different pace, but knowing that even small steps are really, worth this effort.
Mhm.
Awesome. Well, Arlene, that's all the questions that we had for you. So thank you so much for taking the time. Thank you for helping us, create this video series. We're so excited to be able to put those out later this fall. And yeah, just thank you so much for speaking to us and for all the work that you do to make physical therapy and, chronic illness-friendly care more accessible.
Thank you. I just wanted to say that, meeting the Long COVID Collective. It's so special. I can't describe like how amazing this community is, like how supportive you all are, and how supportive you all have been for me too. So I just think you're amazing, and I want this to keep growing and keep people to find you, so that it's bigger and bigger and bigger.
Aw, thank you. We appreciate it. And we're so happy to have you as part of that team, and part of our system to help us reach the people, to help us be bigger. So thank you. I appreciate that. That means everything.